Depression. A word that has become increasingly common in our vocabulary, yet often misunderstood in its true nature and impact. While we all experience sadness, disappointment, or grief at different points in our lives, depression is something far more profound, a condition that affects millions worldwide, altering how they think, feel, and navigate their daily existence. In the next 15 minutes, we'll explore depression, what it truly is, how it manifests, what causes it, and most importantly, how it can be addressed and treated. Whether you're personally experiencing depression, supporting someone who is, or simply seeking to understand this condition better, this journey through the landscape of depression aims to provide clarity, insight, and hope. Defining depression. Depression is not simply feeling sad or going through a rough patch. It's a serious mental health condition that requires understanding and treatment. Clinically known as major depressive disorder, depression affects how you feel, think, and handle daily activities, from sleeping and eating to working and interacting with others. The World Health Organization reports that approximately 280 million people worldwide live with depression, making it one of the leading causes of disability globally. Despite its prevalence, depression is often misunderstood, stigmatized, or dismissed as a mere mood that someone can snap out of with sufficient willpower. What differentiates depression from normal emotional responses to life's challenges is its persistence, intensity, and impact on functioning. While grief, sadness, or disappointment naturally arise in response to difficult situations, these feelings typically come in waves and gradually diminish over time. Depression, however, persists for weeks, months, or even years, coloring every aspect of a person's life with a persistent darkness that doesn't lift in response to positive events or encouragement. Depression doesn't discriminate. It affects people across all ages, backgrounds, and walks of life. It can affect the high-powered executive, the college student, the new parent, the retired elder. No one is immune. And, importantly, depression is not a choice, a weakness, or a character flaw. It's a complex condition with biological, psychological, and social dimensions. Recognizing the symptoms. Depression manifests differently in different people, but there are common symptoms that characterize this condition. These symptoms generally fall into emotional, cognitive, and physical categories. Emotional symptoms often include persistent sadness or emptiness, loss of interest or pleasure in activities once enjoyed, feelings of hopelessness or pessimism, irritability or restlessness, feelings of worthlessness, guilt, or helplessness. Cognitive symptoms may involve difficulty concentrating or making decisions, persistent negative thoughts, thoughts of death or suicide, excessive self-criticism, distorted thinking patterns where neutral events are interpreted negatively. Physical symptoms commonly include changes in sleep patterns, either insomnia or sleeping too much, changes in appetite and weight, either increased or decreased, fatigue and decreased energy, moving or speaking more slowly than usual, unexplained physical problems like headaches, digestive issues, or chronic pain. For a clinical diagnosis of major depressive disorder, symptoms must be present for at least 2 weeks and represent a change from previous functioning. However, many people experience symptoms for months before seeking help, often attributing their struggles to stress, overwork, or personal failings rather than recognizing them as depression. It's worth noting that depression can present differently across demographic groups. In men, depression sometimes manifests as anger, irritability, or reckless behavior rather than sadness. In children and adolescents, irritability may be more prominent than depressed mood. In older adults, cognitive symptoms like memory problems may be more noticeable than mood changes. If you recognize several of these symptoms persisting for more than 2 weeks, it's important to consider the possibility of depression and seek professional evaluation. The causes of depression. Depression rarely has a single cause. Instead, it typically results from a complex interplay of biological, psychological, and environmental factors. Biological factors include genetics. Depression can run in families, suggesting a hereditary component. Brain chemistry. Imbalances in neurotransmitters like serotonin, norepinephrine, and dopamine play a role. Hormonal changes, such as those occurring during pregnancy, postpartum, thyroid problems, or menopause. Medical conditions. Certain illnesses like chronic pain, cancer, or heart disease increase depression risk. Psychological factors involve personality traits, tendencies toward pessimism, low self-esteem, or being easily overwhelmed by stress. Early life experiences, childhood trauma, abuse, or neglect can affect brain development and increase vulnerability. Cognitive patterns, habitual negative thinking, self-criticism, or rumination. Environmental factors include chronic stress from work pressure, financial problems, or caregiving responsibilities. Significant life events, such as job loss, divorce, bereavement, or relocation. Social isolation, lack of supportive relationships and community connections. Substance use. Alcohol and certain drugs can trigger or worsen depression. Understanding these various contributors helps explain why depression can't be overcome through simple willpower or positive thinking. Just as you wouldn't expect someone to will away diabetes or heart disease, depression requires proper understanding and treatment. The impact of depression. Depression reaches far beyond mood, affecting virtually every aspect of a person's life. Its impact can be profound and far-reaching. Daily functioning often becomes impaired. Simple tasks like getting out of bed, showering, or preparing meals can feel overwhelmingly difficult. Work performance typically suffers, with decreased productivity, difficulty concentrating, and increased absenteeism. For students, academic performance may decline significantly. Relationships are frequently strained. People with depression often withdraw from social activities and connections. They may find it difficult to communicate effectively or participate in family life. Irritability can lead to conflicts, while emotional numbness can create distance even in previously close relationships. Physical health is affected as well. Depression is associated with disrupted sleep patterns, compromised immune function, and increased inflammation throughout the body. It's linked to higher rates of cardiovascular disease, diabetes, and other chronic conditions. The relationship works both ways. Depression can worsen physical health, and physical illness can trigger or exacerbate depression. Self-perception often becomes distorted. People with depression frequently develop a negative view of themselves, their worth, and their future prospects. They may see themselves as burdens to others or believe they're fundamentally flawed in ways others are not. Most seriously, depression significantly increases suicide risk. The pain of severe depression can become so overwhelming that death seems like the only escape. This is why recognizing and treating depression isn't just about improving quality of life. It can be literally life-saving. Treatment approaches. The good news about depression is that it's highly treatable. Between 80 to 90% of people with depression eventually respond well to treatment. Several effective approaches exist, often used in combination for best results. Psychotherapy, or talk therapy, helps people understand and address the thoughts, behaviors, and patterns contributing to depression. Evidence-based approaches include cognitive behavioral therapy, CBT, helps identify and change negative thought patterns and behaviors. Interpersonal therapy focuses on improving relationships and communication patterns. Psychodynamic therapy explores how unconscious feelings and past experiences affect current behavior. Medication can be highly effective, particularly for moderate to severe depression. Antidepressants work by balancing chemicals in the brain called neurotransmitters that affect mood and emotions. Several types exist. Selective serotonin reuptake inhibitors, SSRIs, often prescribed first due to fewer side effects. Serotonin and norepinephrine reuptake inhibitors, SNRIs. Atypical antidepressants. Tricyclic antidepressants. Monoamine oxidase inhibitors, MAOIs. It's important to understand that antidepressants aren't happy pills or sedatives. They don't create artificial happiness, but rather help remove the biological barriers to experiencing normal emotions. They typically take 2 to 4 weeks to show benefit, and finding the right medication may require trying different options. Lifestyle modifications play an important supporting role. Regular physical exercise has been shown in multiple studies to reduce depression symptoms. Maintaining consistent sleep schedules helps regulate mood. Balanced nutrition supports brain health. Limiting alcohol and avoiding recreational drugs. Stress management techniques like mindfulness meditation. Social connection, even when it feels difficult. For severe or treatment-resistant depression, additional options include electroconvulsive therapy, ECT. Despite its sometimes negative portrayal in media, modern ECT is safe and often highly effective. Transcranial magnetic stimulation, TMS, a non-invasive procedure using magnetic fields to stimulate nerve cells. Ketamine therapy, particularly for severe depression with suicidal thoughts, can provide rapid relief. The most effective approach is often a combination of treatments tailored to the individual's specific needs, preferences, and circumstances. Living with depression. For many people, depression isn't a one-time event, but rather a condition that requires ongoing management. Understanding how to live well with depression involves several key aspects. Recognizing early warning signs is crucial. Each person typically has unique patterns that signal potential relapse, changes in sleep, withdrawal from activities, increased negative thinking, or irritability. Identifying these early allows for prompt intervention before depression deepens. Building a support network provides essential stability. This might include understanding friends and family, support groups, in person or online, and healthcare providers. Being open with select people about your condition can help them provide appropriate support. Developing a wellness toolbox, personalized strategies that help maintain mental health, proves invaluable. This might include regular exercise, creative expression, time in nature, journaling, or spiritual practices. Creating structure and routine helps counter depression's tendency to disrupt daily functioning. Simple routines around sleep, meals, exercise, and pleasurable activities provide stability even when motivation is low. Practicing self-compassion means treating yourself with the kindness and understanding you would offer a good friend. This isn't self-indulgence, but rather an evidence-based approach that supports recovery and resilience. Celebrating small victories acknowledges progress, however modest it might seem. On difficult days, even getting out of bed or taking a shower represents an important achievement. The journey through depression isn't always linear. There may be setbacks along the way. But with proper treatment and support, people with depression can and do recover, going on to lead fulfilling, meaningful lives. Supporting someone with depression. If someone you care about is experiencing depression, your support can make a meaningful difference. Here's how you can help effectively. Educate yourself about depression so you understand what they're experiencing. This helps you respond with empathy rather than frustration or impatience. Listen without judgment. Sometimes the most powerful thing you can offer is your presence and willingness to hear their experience without trying to fix it or offer platitudes like, "Everything happens for a reason." Encourage treatment, but understand that you cannot force help on someone unless they're in immediate danger. Express your concerns specifically and offer to help them find resources or accompany them to appointments. Be patient and persistent. Depression can make people withdraw or reject help. Continue to extend invitations and support, even if they're frequently declined. Offer practical support with everyday tasks that might be overwhelming during depression: grocery shopping, childcare, household chores, or meal preparation. Conclusion: beyond the darkness. Depression can feel like being trapped in a dark room where all the lights have gone out and the door has disappeared. But even in that darkness, it's important to remember that the door still exists and the potential for light remains. If you're currently experiencing depression, know this: you are not alone. Your pain is real, but it is not permanent. Treatment works, help is available, and recovery is possible. The very fact that you're listening to this suggests the strength and resilience within you. If you're supporting someone with depression, your compassion matters more than you know. You cannot single-handedly lift someone out of depression, but your understanding and presence can be a lifeline during their darkest times. For all of us, greater awareness of depression helps create a world where mental health is discussed openly, treated effectively, and supported compassionately. Depression thrives in silence and isolation. It begins to lose its power when brought into the light of understanding and connection. As we conclude this exploration of depression, remember, this condition can be incredibly painful and debilitating, but it doesn't define a person's identity or determine their future. With proper understanding, treatment, and support, the shadows of depression can recede, allowing the full spectrum of human experience, including joy, meaning, and connection, to return.